The dog and the toddler were nose to nose on the living room floor. What the parents thought they were seeing was completely wrong. Everything looked normal that Saturday morning. It wasn't. Honey was a 4-year-old golden retriever who had never in her life been described as intense. Soft was the word people used. Easy. The kind of dog who flopped onto her back the moment anyone came through the door. She had been around 2-year-old Priya since Priya arrived home from the hospital, and in that entire time she had never once pushed toward the child, never positioned herself the way she was positioned now, sitting directly in front of the girl, face level, close enough that Priya had to tilt back slightly to see past the dog's muzzle. Priya was reaching for something on the floor. Honey shifted with her, staying centered, staying close. Priya moved left. Honey moved left. Rahul saw it from the kitchen doorway. His first read was herding behavior or resource guarding or something he'd been warned about when they were deciding whether to keep the dog after Priya arrived. A big animal getting between a child and what the child wants. He'd heard that phrasing from 3 different people. He crossed the room. Honey, come. The dog turned her head toward him, then turned back to Priya. He said it again. She didn't move. His wife Sonali came in from the hallway and stood beside him. Priya was making sounds now, fussing, not crying. The kind of restlessness that could mean anything at 2 years old. Honey had her nose 6 inches from the child's mouth and was inhaling in slow, deliberate pulls. Eyes soft and steady, body completely still. Sonali was a pharmacist. She understood behavior through mechanism. What she was watching had a mechanism, and the mechanism looked like a large dog fixating on a small child's face, with no context and no explanation. She had never seen Honey do anything like this. That was exactly the part that concerned her. New behavior in a previously predictable animal has a cause. She just didn't know what the cause was yet. They moved Honey to the back room. Priya seemed fine afterward, ate her lunch, played with her blocks, fell asleep for her nap without any trouble. Sonali told herself they'd call the vet the next day. The dog was probably just responding to something in Priya's new shampoo or a change in the girl's scent from the outdoor play that morning. There were explanations. She knew how to find explanations. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Priya woke from her nap differently. Not crying, but strange. She was sitting in the corner of the crib holding the rail, quiet in a way that had no texture to it, no animation. Sonali picked her up and felt the dry heat of her skin a full second before her hand registered it. She got the thermometer, 103.4. She gave Priya water. An hour later, 103.8. She called the after-hours pediatric line and described the symptoms. The nurse asked how long the fever had been building. Sonali said she didn't know. The nurse said bring her in. At the after-hours clinic, Dr. Yemi Adeyemi, 9 years in pediatric medicine, ran a blood panel. He came back into the room and set the chart on the counter before he spoke. Priya's glucose was elevated. Not critically, but outside normal range in a way that pointed to something her body had been doing for a while. He explained the early markers of insulin dysregulation, the kind that begins before any outward symptom presents clearly, the kind that a parent monitoring a healthy-seeming toddler would have no reason to look for. Her body has been doing this for a few weeks, minimum, he said. The fever is separate, a viral infection, but the glucose pattern is what we need to follow up on. Sonali said, is there any way a dog could detect elevated blood glucose in a child? He looked at her for a moment. Then he said, yes, that's been documented. They use volatile ketone compounds on the breath. Why? She described Honey's behavior from that morning. He was quiet for longer than felt comfortable. Then he said, I think your dog was reading something we would have missed for another few weeks. Has your dog ever done something you couldn't explain until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. Honey came back from the back room that evening. She walked directly to Priya, who was on the couch wrapped in a blanket, and lay down on the floor beside the cushion without being invited. She put her chin on the edge of the cushion near the girl's feet. She stayed there until Priya fell asleep. Sonali sat on the other end of the couch and watched the dog's face in the low lamplight. There was nothing readable in it, nothing theatrical, just the specific stillness of an animal that is exactly where it intends to be. Every guardian deserves to be recognized, even the ones who never ask for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Priya is being monitored now. Her levels are managed. The follow-up revealed what Dr. Adeyemi had suspected, and Honey hasn't left her side since Thursday evening. The next story we're sharing involves a dog who changed its behavior around a family member. 3 weeks before a diagnosis no one was looking for. Priya is 24 months now. The monitoring is routine, the management steady. Honey still moves to her position beside the girl every morning. Not at mealtimes, not at any specific hour. Just when she decides to, for reasons the family has stopped trying to rationalize. What they have accepted instead is simpler. Some things in that house are being watched. Not all of them by people. That distinction now sits at the front of how they think about their dog, their daughter, and the specific quality of attention that looks like nothing until it looks like everything.